This is a tribute to all those who report their surgery on the sign database. We appreciate your reports, especially when you report follow-up until the fracture has healed. All of these segments were put together because they are recurrent themes when I review the database. I hope the information here will be shared with all sign surgeons in your program who do sign surgery, and we welcome feedback. Distal femur fractures are increasing, and we're looking for different ways to immobilize these fractures. This distal femur fracture is very comminuted. It's intracondylar, which means it goes into the joint, and this is a big operation to be stabilized. We also must remember that the femur rotates along with the tibia during gait, so there is rotational stress at the fracture site which can slow healing. We have decided we should try to use a plate in addition to using a nail in these fractures. We have used the same plate we use in the subtrochanteric fractures and find that it works very well. Long oblique fractures are common in older people, and these must be anatomically reduced and probably stabilized with a plate to hold our reduction in these fractures. You can see this was stabilized by a plate. The nail may be a little short here, but this fracture healed. We also have considered plates and diaphysis. Many orthopedic surgeons don't believe that plates should be used in the diaphysis of long bones. And we have looked afresh at this and decided that perhaps there is a place for plates along with nails. This was a woman who had a 2-year-old non-union treated with plates and then another plate, both of which failed, and finally using a nail in combination with the plates allowed that fracture to heal. So I think we need to look at all fractures with fresh eyes. Distal femur fractures are a definite indication for a retrograde approach. Look carefully at the fracture site and look at the isthmus in comparison with the diameter of the nail. There's not good stability in this fracture, and therefore we believe that the retrograde approach does provide better stability. The surgeon attempted to rectify the loss of reduction using cerclage wires, which unfortunately did not work, and he revised the fracture with a retrograde approach, holding the fracture well. Note that he used a standard nail, and I'd like to address that later. This is one of the first retrograde approaches to the femur that sign was used in, but is probably one of the first in the world because it was done 20 years ago. This was a floating knee, which means a fracture of the tibia and the femur, and she is standing on this fractured leg 6 weeks after surgery. At that time, we were communicating by mail and sending pictures. This is another fracture, distal fracture. Look carefully at the isthmus compared with the size of the nail and look at what happened. This is not good stability. The fracture did not heal because of rotational stress, and the deformity increased until the nail broke. This was revised to a retrograde fin nail with good healing of the fracture. This is the reason not to use a standard nail in retrograde if the nail ends in the high stress area of the femur. The surgeon puts a stress concentrator in the high stress area of the femur by making a screw hole, and the patient can fracture through this screw hole if he or she has additional trauma. This is the ideal situation of a retrograde fin nail. When you place a retrograde nail through the knee, you can compress the fracture site by placing the interlocking screws first and then hitting the locking bolt to compress the fracture site. This will accentuate and hurry fracture healing. We're still considering when the patient should bear weight in different fractures. We are also looking at placement of the sign nail in previously infected bone. This is a problem that occurs more frequently in developing countries. We're also looking at the influence of a delay between the injury to wound closure and nail insertion. We're also looking at new methods to prevent infections in open fractures, and we invite your comments on these.